Good evening. I'm Glenda Brazier Britton, and tonight I want to speak with you about advocating for public health policy changes. While there are a variety of public health issues that America faces daily, such as mental illness, cancer, health disease, obesity, and communicable illness and diseases, all of these conditions are definitely of major concern. However, some conditions are more prevalent to prevention than others. Still, yet, singling just one of the public health issues can be difficult. But because only one public health issue can be the focus for this discussion, diabetes will be the public health issue addressed here. To date, there have been advancements in medical progress to aid in prevention and education and treatment of many medical conditions such as diabetes. Yet millions in every age group still suffer from the disease. Because of those reasons, I like to advocate for changes to be made in the public health policies where diabetes is concerned. In particular, I like to add that we propose that we add this as a covered benefit for those that are pre-diagnosed with diabetic stages. The proposed policy is lined up with the Center of Disease and Control and Prevention, along with the national prevention programs that have already introduced a lifestyle change program. This program is designed for pre-diabetic individuals, as I mentioned, and would go into providing education and prevention on the individual basis. Now, the proposed program would initiate policies to add the diabetes and education prevention as a covered medical benefit under plans that already have medical coverage. So instead of having those persons excluded from plans and or paying for the treatment, it is best suggested that we pay for the prevention and an education, especially when they're in their pre-diabetic stages. So therefore, the disease and the condition has not yet been formed, however, provides us warnings that this is a serious matter and our condition that is likely to be reversed through the education and the prevention programs. The impact of the policy changes would be that the program would be able to aid in the prevention with individuals who are in stages of diabetic reversal. The cost for the prevention would be significantly less than the treatment of the disease itself. The risk of not implementing this policy is the cost of lives and definitely the cost of quality living. The only risk for implementation would be the controlling costs for specialists and the education. Again, sharing a bit less of the cost for trying to treat the condition in itself. And the lives of the pre-diabetic individuals could be altered and with prevention rather than treatment. Again, I want to emphasize that the treatment is way more costly than prevention and education to avoid this condition. The rationale for the changes would include aiding in finding solutions for the healthcare disparity, especially diabetes. The proposed changes provides protection from expensive medical care from the condition. The proposed changes would also cover the benefits under the plan, so the individual's prevention rather than treatment can be utilized. The policy proposed benefit coverage would eliminate the financial burden of a hospitalization, which is shared by taxpayers and occurs when the lack of healthcare coverage and when the disease exists. There are also social, cultural influences that should be considered. These factors include the cultures where diabetes exists, the economics of those social societies, as well as the ethnicity groups that are most affected. Although this plan would offer coverage, the plan would limit care to prevention and education to mitigate the development of the disease. The plan benefits are administered with cultural awareness so that the patients can easily understand that their care is the most important. And cultural sensitivity training is offered to those who provide direct patient care. This will provide a unique consideration as the humane approach is taken, and there is no hierarchy based on social economic class. The shared responsibility of costs would be shared through the taxes, diverting the tax payment from hospitalizations of those who had no coverage, and as we've mentioned, the expensive care that it would cost, to a least expensive prevention of those who have been diagnosed early to provide prevention. And finally, the fiscal control would the fiscal control would be rather than having to foot the bill for payment for the full treatment. So again, all reasons to consider the policy changes and vote yes for the implementation. In conclusion, decision making can always be difficult, especially when the legislative changes are under consideration. But these decisions can often be complex as the resolution may be contrary to your personal beliefs. But the decisions are essential to change and potentially saving lives. These changes are based on patient-centered ethics to care for the most vulnerable. Also, these changes will have a tremendous impact on the community, combating a nationwide healthcare issue to seek diabetes control. Every effort to correct the social uncertainties in healthcare can be realigned when strong policy, legislation is added to correct healthcare disparities that diabetes and other diseases like diabetes cause. Again, as we mentioned, there are multiple diseases and healthcare disparities that could have been mentioned, but because we're only focusing on one change, although there are very many, we want to implement the changes for diabetes control and health, as it affects almost everyone from juvenile stages to adult stages. This disease has affected everyone in every age group. So the proposed changes, although are a part of a highly charged debate, the plan aspires to meet the need of those regardless of social and economic diversity, while the humane approach is taken to allow these policy changes. I believe that these changes will bring about effective healthcare corrective measures. I also believe that with this information shared, that you too will have no choice but to vote yes for the changes being requested. And the vote is not a literal vote, but a change in mind and making a decision to do right thing, especially where the health care of those that are most effective are concerned. Again, I thank you for your time. My name is Glenda Brazier Britton, and this has been my presentation.